Botox is used to treat fine lines of the face. For instance, lines on the forehead, lines around the corners of the eyes, and lines around the mouth. Now we're working with teeth every day, and we start to think about aesthetics. We do veneers, we do composite bondings, and then we start to realize that not only can we affect the smile with working with the teeth, but also the muscles of the face. Some of you may be wondering how Botox works. Botox is a medication that's placed under the skin and causes the muscles that would create these fine lines and wrinkles from moving. We can also use Botox for facial pain. People who have tension in their muscles here and here. Some patients who get migraines, it's actually related to their muscles, so we can use Botox for that as well. At the first consultation appointment, we'll map out your specific needs and what you're interested in, and then we'll go ahead and schedule an appointment for you to come in and have the treatment done. At that stage, you can expect a 10 to 15 minute appointment to complete everything. The Botox will be placed in very select areas, specifically problem areas that the patient requests. Once administered, patients will start to see results within 3 days. Those results will last up to 3 months, and patients can return periodically for more treatments. Due to the nature of Botox not being permanent, patients can come back as they wish for more treatments. Botox can be a great tool for patients who need muscle relaxation, who can't take typical muscle relaxer medications. Oftentimes a patient will come to us and complain about tension or pain in this muscle right here, but some of the medications that they're taking cause us to not be able to prescribe anything safely. In cases like that, we'll administer Botox in this area in a small injection in order to give the muscle relief. When the Botox is being administered, patients explain that there's very little discomfort. Even when compared to dental injections, which we do our best to make comfortable for patients, the Botox injections are even less uncomfortable. So there's several areas of the face that we can treat for you with Botox. Let's start with the frontalis muscle. That's the muscle on the forehead that causes these horizontal lines. By placing the Botox here, we can eliminate these lines from forming. The next area we can talk about is what we call the 11s, or something that can form right here from the corrugator muscles. As we frown, we can form permanent creases here that looks like the number 11. By treating this area with Botox, this will all get smoothed out and it won't form permanent lines. The next area we can talk about is an area called crow's feet. You might be familiar with that term. It forms right here at the corner of the eye. Some people will smile with their eyes and they'll squint and they'll form all these lines coming out this way radially from the corner of the eye. So by injecting the Botox here, we can eliminate those lines. The last area that we can treat at this time, and the area that pertains mostly to dentistry, is the muscle that surrounds the lips, the orbicularis oris. That muscle, when it contracts, can create what's called water bottle lines or smoker's lines that form around the edges. So in treating the muscles around the mouth, we can perform what's called a lip flip. You might have heard about it. By injecting a small amount of Botox around the lips, we can relax the muscles and the lips will appear more full. So whether you're looking for relief from muscle tension on a short-term basis or long-term prevention of fine lines and wrinkles, Botox may be for you. So if you've had Botox before or you're interested in learning more about it, please comment below or call our office, schedule your consultation, and we'll get everything worked out.